Hi, and welcome to today's Daily Chronicle. Today is Wednesday, November 5th, 2025. Searching weight can bring up Ozempic in results. It's a drug advertising loophole. If you've Googled weight loss, there's a good chance that one of the first search results that came up was a website for Ozempic. But Ozempic hasn't been approved by the FDA for weight loss. It's only been approved to treat type 2 diabetes. So why is it showing up there? The answer is something called a sponsored search result. Companies pay search engines so that their websites are among the first results you see. If you enter certain keywords or phrases, search engines are often the first place people go when they have health questions, says Daniel Klein, a research fellow at the Program on Regulation, Therapeutics, and Law at Harvard Medical School and Brigham and Women's Hospital. Pharmaceutical companies have figured out how to game that system with pay-per-click ads, which are essentially their way of buying their way to the top of search results, he added. Normally, drug companies have to follow strict rules when it comes to advertising their products in magazines or television commercials. They have to do things like disclose risks or side effects of the drug, and they can't advertise a drug to treat a condition that hasn't been FDA approved to treat, even if doctors may sometimes prescribe that drug off-label to treat other conditions. If they do, the companies can get in trouble with the FDA. The idea is to prevent ads containing false or misleading material that can potentially hurt someone. But online sponsored search results, which are usually appear on top of other results, aren't regulated the way TV ads are. The law hasn't caught up to the changing technology. Eisencraft-Klein and his colleagues looked at 2 years of paid research results for Ozempic sponsored by the drug maker, Novo Nordisk. They published their study results in the medical journal JAMA Network Open. They found that 11% of the search keywords or phrases the company paid for continued the word weight, even though Ozempic isn't approved for weight loss. They also found that Novo Nordisk paid for search results even when the keywords referred the drug's main competitors, such as Trulicity and Mounjaro, manufactured by Eli Lilly. Novo Nordisk sponsored the search term Kelly Clarkson weight loss, presumably because they're searching for celebrities and weight loss might be interested in their product, Eisencraft-Klein says. The researchers focused only on Ozempic for their study, and more research is needed to look into sponsored results for other drugs and therapeutics, he says. Still, Eisencraft-Klein says the study can be lessons for consumers. Don't assume that Google is just showing you the most relevant information. Just because it's first doesn't mean it's the most objective or the most relevant. He recommended scrolling past the sponsored search results and looking for independent sources, such as academic medical centers, when doing medication research online. Contacted by NPR for comment, Novo Nordisk spokesperson Liz Skrobova said in an email that the study misrepresents the company's paid search approach, which she says uses industry-standard compatibilities to reach consumers. Novo Nordisk is in compliance with U.S. laws and regulations, she added, as well as its own ethical standards, so that patients can find information about our medicines to make shared decisions with their healthcare professionals about their care. The United States is one of the only countries that allows direct-to-consumer advertising for prescription drugs. The Trump administration sent a memo calling on the FDA to crack down on prescription drug advertising. In September, saying companies had been lax about disclosing risks. The FDA also sent out a slew of enforcement letters to companies about their drug ads. The FDA is committed to making sure that promotional communication for prescription drugs are truthful, balanced, and accurately communicated. According to an email from Emily Hilliard, a spokesperson for the Department of Health and Human Services, the parent agency for the FDA, she also encouraged people to report concerns to the agency's bad ad program. A Google spokesperson, Nate Funkhauser, said in a statement to NPR that it has clear policies for advertising prescription drugs. Advertisers are fully responsible for ensuring their advertising strategy, including all keywords and content, adheres to regulatory requirements. Worsening listeria outbreak tied to pasta products kills 6, hospitalizes 25. A listeria outbreak linked to prepared pasta products has killed 6 people and sickened over 24 across the 18 states, federal health officials say. A deadly listeria outbreak connected to prepared pasta meals sold at grocery chains nationwide is worsening, federal health officials say. As of late October, the outbreak has killed 6 people and sickened 27, all but 2 of whom were hospitalized. According to last week's update from the Centers for Disease Control and Prevention, one of those affected was a pregnant mother, resulting in fetal loss. Cases have been reported in 18 states: California, Florida, Hawaii, Illinois, Indiana, Louisiana, Michigan, Minnesota, Missouri, North Carolina, Nevada, Ohio, Oregon, South Carolina, Texas, Utah, Virginia, and Washington. Since the last CDC's case count update on September 25th, 2025, a total of 7 new illnesses from 3 states have been reported, with 2 additional deaths reported. The Food and Drug Administration, FDA, said that list has grown in recent months. The outbreak started in June, when listeria concerns prompted recalls of several brands of ready-to-eat chicken, fettuccine alfredo meals made by Fresh Real Inc., and sold under the Home Chef brand at Kroger and the Market Side brand at Walmart. In response, Fresh Realm began testing some of its pasta samples, and in mid-September, they came back positive for Listeria. Further genetic testing confirmed it was the same strain of Listeria that was detected in Fresh Realm's previously recalled chicken Alfredo meal, the FDA said at the time. The discovery prompted the recall of 2 more products with specific use by dates in late September and early October. Market Side linguine with beef, meatballs, and marinara sauce. Sold at Walmart and Trader Joe's Cajun-style blackened chicken breast fettuccine Alfredo. They shared a pasta supplier. Nate's Fine Foods, the company supplies pre-cooked pasta and grains to the wholesale food service and restaurant industries, according to its website. In late September, Nate's further expanded its recall to include other batches of pre-cooked pasta, including fettuccine, linguine, and farfalle, bow tie. After a sample of linguine pasta collected and tested by Fresh Realm tested positive for Listeria monocytogenes, the FDA said. Early October saw the recalls of several more pre-made pasta salads and heat and eat noodle dishes sold at Trader Joe's, Albertsons, Kroger, Walmart, Giant Eagle, and Sprouts locations across the country. In late September statement, Nate's said it was recalling the products out of an abundance of caution and apologized for any concern it had caused. Our top priority is ensuring the safety of the people who enjoy our products. And we will continue to take all appropriate steps until this matter is resolved, it said, adding that it is working closely with the CDC, FDA, and state health officials to identify the source. The FDA says it is working with Nate's to determine if additional recalls are needed. Health officials say customers who purchased any of these meals should throw them away and clean the refrigerators, containers, and any surfaces that may have had contact with the food. At this point, the products that are recalled between June and October are more likely to be in customers' fridges and freezers than on the store shelves themselves. Most of them had to use by dates earlier than October 10th. The recalled product with the longest shelf life is a frozen meal, Scott and John's shrimp scampi, with linguine bowls. Those dishes, which were distributed to wholesale distributors and operators nationwide, have best by dates in March 2027. A spokesperson for the company told NPR that retailers have removed the product from their shelves. What to know and do about listeria. Listeria infection, or listeriosis, is most likely to sicken pregnant people and newborns, adults over 65, and people with weakened immune systems. Pregnant people may only experience mild symptoms like fever, fatigue, and muscle aches. But we should be aware that listeria could cause miscarriages, premature delivery, or life-threatening infection of their newborn. Symptoms include fever, muscle aches, gastrointestinal issues, stiff neck, confusion, and loss of balance. They usually start within 2 weeks of eating contaminated food, but could start as soon as the same day or as late as 10 weeks later, the CDC says. It can be hard to confirm the scope of an outbreak, since some people recover from the infection without medical care. For those who do require medical attention, the CDC says it usually takes 3 to 4 weeks to determine whether the illness is part of an outbreak. The CDC says it has interviewed 13 of the people who got sick as of late September. 7 of them reported eating pre-cooked meals before their illness started, and 4 specifically mentioned eating chicken, fettuccine alfredo. The CDC and FDA say consumers should contact their healthcare provider to report any symptoms of listeriosis and receive care. They also report any adverse health effects to the FDA online. The U.S. has seen a number of listeria outbreaks in the past year. A 2024 outbreak tied to deli meat left 10 people dead and dozens more hospitalized across the country. A U.S. Department of Agriculture report released in January blamed inadequate sanitation practices at a since-closed Boar's Head facility in Virginia, and listed several steps it would take to better protect the public from listeria. In February, nearly 2 million baked goods, including some donuts sold at Dunkin', were recalled over listeria concerns. That same month, frozen shakes sold to nursing homes and long-term care facilities were recalled in connection with listeria outbreak dating back to 2018. The FDA says that outbreak sickened 42 people and killed 14 across 21 states. Before authorities declared it over in May. SNAP benefits will restart, but will be half of the normal payment and delayed. Food banks around the country are trying to pick up the slack from the pause in SNAP benefits. The courts say benefits must be restored, but it is unknown when. Here, Park Hill Food Pantry volunteers in Denver work to fill the needs on Friday. The Trump administration says it will restart SNAP food benefits, but it will pay out only half the amount people normally get. The administration says it will use money from an agriculture department contingency fund. The $5 billion in that fund falls well short of the full cost of SNAP benefits, $8 billion each month. In a court filing, officials said depleting that fund means no funds will remain for new SNAP applicants certified in November. Disaster assistance, or a cushion against the potential catastrophic consequences of shutting down SNAP entirely. The decision comes after 2 federal judges ruled that the freezing payments for the country's biggest anti-hunger program is unlawful. Even as the money ran out this weekend for the 42 million people who rely on SNAP to put food on the table, the government's response is part of the case in Rhode Island. The Trump administration had until Monday to tell 2 federal judges its plans to restore funding. For SNAP amidst the ongoing federal government shutdown. The administration warns there could be lengthy delays before SNAP benefits get into the hands of low-income families who depend on SNAP to put food on the table. About 1 in 8 U.S. residents get an average of $187 a month per person, which stands for Supplemental Nutrition Assistance Program. Nearly 39% of recipients are children and adolescents under 18, according to the Department of Agriculture, which administers the program. Courts tell Trump to use emergency funds. Citing the government shutdown, USDA froze their funding for SNAP beginning November 1st. The first time that's happened since the country's largest anti-hunger program began 6 decades ago. On Friday, 2 federal judges ruled that this pause is likely unlawful. Both judges said that Congress provided more than $5 billion in emergency funds for exactly this kind of situation, and they rejected the Trump administration's argument that it could not legally use that money to keep SNAP going. It not only can use that money, but must, the judges said. In Rhode Island, Judge John McConnell Jr. called for the contingency funds to be used as soon as possible. A second judge, Indira Talwani in Boston, said officials could also tap additional money from customs revenues, but she left that decision up to the Trump administration, which it has declined to do. Democracy Forward, the legal group that represents cities and nonprofits, in suing the government after it froze funding for SNAP, said Monday that it weighing its next steps to secure full funding for the food assistance program. It shouldn't take a court order to force our president to provide essential nutrition that Congress has made clear needs to be provided. Democracy Forward President and CEO Sky Perryman said in a statement. But since that is what it takes, we will continue to use the courts to protect the rights of people. After the rulings were issued Friday, Trump posted on social media that his lawyers would seek clarity from the court on how to fund SNAP, and if they got it, it will be my honor to provide the funding, just like I did with military and law enforcement pay, Trump wrote. Treasury Secretary Bob Bessent told CNN Sunday that the Trump administration would not appeal the judge's rulings. He said it's possible that funding for SNAP could be restored by Wednesday, but there's a process that has to be followed. We've got to figure out what that process is. Delays and a logistical nightmare. A delay in benefits was expected regardless of the outcome of the court cases, because many beneficiaries have their cards recharged early in the month, and the process of loading cards can take a week or more in many states. The government said Monday that state agencies will have to recode their eligibility system to adjust for the reduced benefits. And it is unclear how quickly state systems will be able to do so. It warned that in some states, those system changes will take anywhere from a few weeks to up to several months. The Trump administration has previously said that calculating partial payments is a logistical nightmare that could take time to arrange in the middle of a shutdown. Several states have said that they will use their own funds to cover any shortfall in SNAP funding. However, the Trump administration has warned it will not reimburse states. Several states, including Arkansas, New Hampshire, and Washington, have also announced measures to help support food banks and pantries. Food banks can't replace SNAP. What is clear is that a lot of money has disappeared from people's budgets, food budgets, and anti-hungry advocates say that food alone will not be able to make up the difference. We're in uncharted territory, Elizabeth Keever, Chief Resource Officer at Harvesters, a food bank in Kansas City, Missouri, told NPR Sunday. It's nearly impossible to make up a gap that SNAP is leaving us, but we're doing everything we can to make sure that we're easing this burden for folks. Keever said, "It's just this really scary moment where there's a lot of uncertainty. So the gap is massive, and at the end of the day, food banks can't necessarily fill it."